Have you ever felt that quiet confusion after hearing health news, wondering if you are missing something important? One of my patients once shared that she read every headline, yet still felt unsure about what truly mattered for her family. I want you to imagine this for a moment. A kitchen table in the evening, a loved one asking a simple question, and no clear answer that feels calm or complete. I am Dr. Evelyn Carter, and I have spent many years caring for older adults and listening closely to families just like yours. When the name Nipah virus appears in the news, it can sound alarming. The truth is that Nipah virus is rare. It is not a daily threat, and it is not something most families will ever encounter. What creates unease is not the virus itself, but the feeling that important context is missing. When we say what families are not being told, we are not talking about hidden dangers. We are talking about perspective. In clinical practice, I have seen how media stories focus on events, numbers, and urgency. What they often leave out is reassurance. They rarely explain how risk is evaluated, how systems respond, or why calm understanding matters more than fear. Science tells us something very simple. When people feel informed and safe, they make better decisions. Stress can cloud judgment, raise blood pressure, and disturb sleep, especially for older adults. Knowledge that is clear and balanced does the opposite. It steadies the mind and supports the body. This video exists for one reason: to help families understand in a way that brings peace, not panic. You do not need more alarming headlines. You need context, honesty, and a voice that respects your concerns. If you find this conversation helpful, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily. Your support allows us to continue offering calm, trustworthy guidance, made especially for seniors and their families. In the next part, we will gently explore why families often feel underinformed and how understanding the full picture can replace uncertainty with confidence. For now, take a breath. The right knowledge, does not increase worry. It brings stability to both the heart and the body. Why families feel underinformed over the years. I have sat with many families who felt surrounded by information, yet still unsure of what to trust. They watched the news, read articles online, and heard fragments from friends, but something essential still felt missing. This feeling does not come from a lack of intelligence or attention. It comes from the way medical information is often shared. Health news tends to move quickly. Headlines are designed to catch attention, not to offer comfort or context. They focus on what is new, what is rare, or what sounds urgent. For families caring for older adults, this creates a gap. You hear about a virus or a health concern, but you are not told how likely it is to affect your daily life or what truly matters for your loved one right now. The result is confusion rather than clarity. In clinical practice, I see this gap clearly. Medical professionals are trained to think in probabilities and patterns. Families think in stories and feelings. When those two ways of understanding do not meet, people feel underinformed even when facts are available. Science can explain risk in numbers, but families need meaning. They want to know what this information changes and what it does not. Another reason families feel unsure is that much health communication overlooks emotional safety. Older adults, especially those living with memory changes or early dementia, are sensitive to tone. Anxiety can disrupt routine, sleep, and appetite. When information arrives without reassurance, it can quietly unsettle both the patient and the caregiver. This is not because the information is wrong, but because it lacks grounding. I often remind families that feeling underinformed does not mean something is being hidden. It usually means the message was not shaped with your experience in mind. The goal should never be to know everything. The goal is to understand enough to feel steady and confident. When information respects patience and dignity, it becomes usable. It supports routine instead of disrupting it. It helps families make thoughtful choices without urgency. That is the kind of understanding we are working toward here. A calm bridge between medical knowledge and everyday life, so you can care with confidence rather than worry. This understanding prepares us to look more closely at what headlines often miss, and why clear explanation matters so deeply for families and seniors alike. What Nipah virus headlines often miss. When Nipah virus appears in headlines, the focus is usually on what is most unusual or dramatic. Words like outbreak, deadly, and rare are chosen because they capture attention quickly. This style of reporting is not meant to mislead, but it often leaves out the information families actually need to feel grounded. Headlines tell you that something exists. They rarely tell you how it fits into your own life. What is often missing is scale. Medical warnings are designed to alert healthcare systems and public health officials. They speak to preparedness, surveillance, and prevention at a population level. Personal risk is something different. It depends on location, exposure, daily routine, and overall health. For most families in the United States, Nipah virus remains a distant concern rather than an immediate one. Headlines rarely pause to make that distinction clear. In my years of practice, I have seen how this gap affects older adults. A single alarming story can linger in the mind, especially for someone already managing memory changes or anxiety. The body responds to stress even when danger is not present. Blood pressure rises, sleep becomes restless, appetite shifts. These effects are real, even if the threat is not. Another detail headlines often miss is context about how health systems respond. When a virus is discussed publicly, it is usually because systems are actively monitoring and preparing. That preparation is a sign of responsibility, not panic. Warnings are meant to keep systems ready, not to signal that families should be afraid. Without that explanation, alerts can feel personal when they are not meant to be. There is also a difference between possibility and probability. Medicine acknowledges possibilities so that nothing is overlooked. Families need probabilities so they can make calm decisions. When that balance is lost, uncertainty grows. This is why clear explanation matters more than constant updates. I encourage families to remember that headlines are a doorway, not the full room. They open a topic, but they do not complete the story. Understanding this helps protect emotional safety. It allows older adults to maintain routine and dignity without carrying unnecessary worry. When we learn to separate public health alerts from personal risk, information becomes steadier. It supports patience instead of fear. This perspective helps families move from reacting to understanding, and it prepares us to talk about how complex information can be translated into language that truly serves everyday care. Nipah virus, explained in plain language. When families hear the name Nipah virus, it can sound distant and unfamiliar, almost like something that belongs in a textbook rather than everyday life. Let me explain it in a simple way. Nipah virus is a virus that was first identified many years ago in parts of Asia. It does not circulate widely, and it is not something most people encounter. For families in the United States, it remains rare. A virus is a tiny organism that needs a living host to survive. Some viruses spread easily from person to person, like the common cold. Others do not. Nipah virus belongs to the second group. It usually appears in very specific settings and requires particular conditions to spread. This is one reason why it does not behave like seasonal illnesses that move quickly through communities. People often ask what Nipah virus does to the body. Like many infections, it can cause fever and fatigue. In some cases, it can affect the brain or breathing. That sounds frightening when stated plainly, but context matters. These outcomes are not common, and they usually occur in places where exposure patterns are very different from what families experience here. The presence of symptoms does not mean the same level of risk exists everywhere. From a caregiving perspective, what matters most is understanding that rarity changes how we think about risk. Rare does not mean ignored. It means monitored thoughtfully. Health systems track viruses like this, so they can respond early if needed. That monitoring is part of routine public health work, not a signal of immediate danger. I often explain to families that learning about a virus does not mean preparing for it emotionally as though it were imminent. It means knowing enough to feel steady if you hear the name again. For older adults, this steadiness is important. Stress can affect memory, mood, and physical comfort. Clear understanding helps protect those areas. Plain language allows us to separate what is possible from what is likely. Nipah virus is possible in the world. It is not likely to affect most families watching this video. Holding both truths at the same time brings balance. When information is shared this way, it supports dignity and patience. It keeps curiosity open without inviting fear. That foundation helps us move forward with clearer understanding of why certain groups receive more attention in discussions and how that attention can be understood without alarm. Why older adults are discussed more often. When discussions about viruses or infections turn toward older adults, it can sometimes feel unsettling. Many seniors tell me they wonder why their age group is mentioned so frequently, as if something is expected to go wrong. The truth is much gentler than that. Age is discussed not because of fragility, but because of how the body naturally changes over time. As we grow older, the immune system becomes more experienced, but also more measured. In younger years, immune responses tend to be fast and energetic. With age, those responses often become slower and more balanced. This can be beneficial in many ways, because excessive inflammation can be harmful. At the same time, a slower response may take longer to recognize unfamiliar infections. This does not mean the body cannot respond. It means it responds differently. There are also physical changes that come with age. Skin becomes thinner and less elastic. Mucous membranes in the nose and mouth may become drier. These surfaces act as natural barriers against germs. Changes here can slightly increase vulnerability, not because the body is weak, but because it has adapted over time. Circulation and lung capacity may also shift, influencing how the body handles stress and recovery. From my experience caring for older adults, these differences rarely define outcomes on their own. What matters far more is the environment around the person. Calm routines, good nutrition, regular sleep, and emotional safety support the immune system in powerful ways. Seniors often thrive when care is steady and respectful. I always remind families that attention does not equal danger. When older adults are discussed in medical conversations, it is because prevention works best when it is thoughtful and tailored. It is an act of care, not a warning. Understanding this can reduce fear. It allows older adults to see themselves not as vulnerable targets, but as individuals whose bodies deserve specific consideration. That perspective supports dignity and confidence, and it prepares families to understand the caregiver role with patience and clarity rather than worry. Caregivers often carry questions quietly. They sit beside loved ones, manage appointments, keep routines steady, and absorb information that never seems to arrive all at once. Many tell me they worry about missing something important, even when they are doing everything they can. This concern is not a sign of doubt or failure. It is a reflection of care. One common worry I hear is how to know what truly matters amid constant updates and changing guidance. Caregivers want to protect emotional safety as much as physical health. They wonder whether mentioning a virus will create anxiety, especially for someone living with memory changes. They ask whether it is better to share information or to keep life feeling normal. These are thoughtful questions, and there is no single right answer. From years of caregiving experience, I have learned that routine is a powerful form of protection. Familiar meals, regular sleep, and predictable days support the body and the mind. When caregivers focus on preserving these anchors, they often do more for health than any headline ever could. Information should serve routine, not disrupt it. Caregivers also worry about their own limits. Many feel responsible for staying informed while also remaining calm. This balance can be exhausting. Science reminds us that chronic stress affects attention and decision-making. When caregivers are overwhelmed, it becomes harder to communicate clearly with healthcare teams. Taking breaks, asking for clarification, and accepting support are not luxuries. They are part of good care. In practice, I encourage caregivers to choose one or two trusted sources and let the rest go. Depth matters more than volume. Understanding the basics allows you to ask focused questions without carrying unnecessary concern. It also helps you translate information into reassurance for your loved one. Caregiving is not about controlling every risk. It is about creating a safe, emotional space where healing and dignity can continue. When caregivers approach information with patience and perspective, they protect not only the person they care for, but themselves as well. This perspective helps caregivers move forward with confidence. It shifts attention from constant vigilance to thoughtful presence. That presence supports trust, preserves routine, and strengthens the quiet partnership between families and care teams. As we move through these conversations together, I want to pause in a very human way, not to interrupt the flow, but to acknowledge something important. Learning about health, especially when you are caring for an older adult or managing changes yourself, can feel like carrying a quiet weight. You want to understand enough to feel prepared, but not so much that it steals your peace. That balance matters. Over the years, I have seen how calm knowledge changes the way people experience care. When families understand what is relevant and what is not, they breathe differently. Their questions become clearer. Their routines feel steadier. This is especially true for those supporting someone with memory changes or early dementia, where emotional safety is just as important as physical comfort. The brain responds best when it feels secure, respected, and unhurried. I often remind caregivers and seniors that you do not need to hold every detail in your mind. You only need the pieces that help you feel grounded. That is why we talk about context, not headlines, and perspective, not pressure. Health information should serve your daily life, not overwhelm it. When learning feels gentle, it becomes useful. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. This invitation is not about urgency. It is about connection. When people who value patience and dignity gather in one place, conversations soften. Fear has less room to grow. Questions are met with care instead of noise. Each shared video becomes a quiet reassurance for someone who may be feeling unsure or alone. Whether you are watching for yourself, for a parent, or for someone you love, I want you to know that this space is meant to feel steady. You are not expected to act quickly or decide anything today. Simply being present and informed is enough. As we continue, keep listening to your instincts. Let understanding settle rather than rush. The more calmly we learn, the more confidently we care. What families should actually focus on. When families hear about a virus or a health concern, it is easy to feel pulled toward extremes. Some people feel the urge to monitor every detail, while others prefer to avoid the topic altogether. In my experience, neither approach truly supports older adults. What helps most is a middle ground that is steady, thoughtful, and kind to everyone involved. Families do not need to change daily life in dramatic ways. There is no need to cancel routines that bring comfort or to introduce constant caution into every moment. Older adults thrive on familiarity. Regular meals, familiar surroundings, and predictable schedules support emotional safety and cognitive stability. When those foundations remain intact, the body and mind cope better with uncertainty. What families can focus on is understanding what information applies to their situation. This means listening carefully to trusted healthcare providers and asking questions that bring clarity rather than alarm. Simple questions are often the most helpful. Asking how risk is assessed, what precautions are already in place, or what signs would actually require attention can replace vague worry with concrete understanding. I have seen many families feel relief once they realize that most health systems are designed to handle a wide range of situations quietly and effectively. When caregivers understand this, they stop feeling responsible for anticipating every possibility. Instead, they become partners in care. This partnership is built on communication, not control. Another important focus is emotional tone. Older adults often sense anxiety even when it is not spoken aloud. When family members approach conversations calmly, seniors feel more secure. This is especially important for those living with memory changes, where emotional cues can influence mood and behavior more than words themselves. Calm presence is a form of care. From a practical standpoint, focusing on a few reliable sources of information helps reduce confusion. Constant exposure to new updates can create a sense of urgency that does not reflect personal risk. Choosing depth over volume allows families to stay informed without feeling overwhelmed. Understanding does not mean eliminating all uncertainty. It means knowing enough to feel steady. When families ask the right questions and trust the answers they receive, fear loses its hold. Care becomes more patient, routines remain intact, and dignity is preserved. This approach supports not only physical health, but also the quiet confidence that allows families and seniors to move through daily life with reassurance rather than strain. Symptoms, safety, and perspective. When families ask about symptoms, they are usually seeking reassurance, not a list to memorize. That instinct is wise. Symptoms are only meaningful when they are placed in context, and context is what keeps understanding calm. With rare infections like Nipah virus, it helps to remember that symptoms do not appear out of nowhere in everyday life. They tend to show up in very specific circumstances, often alongside clear exposure patterns that health professionals already watch for carefully. In general terms, infections can cause common signs like fever, fatigue, or feeling unwell. These are symptoms families recognize because they appear with many ordinary illnesses. What matters is not noticing every change, but noticing patterns. A symptom that is mild and passes is different from one that persists or worsens. Healthcare teams are trained to look at the whole picture, including timing, severity, and surrounding factors. Families do not need to diagnose. They only need to observe gently and communicate clearly. Safety works best when it feels steady. Hospitals and clinics rely on routines that are already familiar, such as careful hygiene, monitoring vital signs, and responding thoughtfully to changes. These measures protect patients every day, not only during rare events. For older adults, this consistency is reassuring. The body responds well when care feels predictable and respectful. From my experience, perspective is the most protective tool families have. When information is shared without urgency, it becomes easier to keep daily life intact. Seniors sleep better, eat more regularly, and feel less unsettled when conversations remain calm. This is especially important for individuals living with memory changes, where emotional tone can influence comfort more than details ever could. I often remind families that safety does not come from constant alertness. It comes from knowing when attention is truly needed and when it is not. If something feels concerning, reaching out to a healthcare provider is always appropriate. That step alone does not mean danger is present. It means care is working as it should. By holding symptoms and safety within a broader perspective, families protect emotional well-being alongside physical health. They avoid unnecessary worry while staying engaged and informed. This balance supports dignity, preserves routine, and allows older adults to feel secure in their environment. Understanding in this way does not minimize health concerns. It places them where they belong, as one part of a larger picture that values patience, trust, and thoughtful care above all else. Awareness without alarm. Awareness is a gentle form of attention. Alarm is something very different. Over many years of caring for older adults, I have seen how easily the two can be confused. Awareness invites understanding and steadiness. Alarm pulls the body into tension and the mind into urgency. For seniors and for those who care for them, that difference matters deeply. Science helps us understand why. When people feel threatened, stress hormones rise, heart rate increases, sleep becomes lighter, concentration narrows. These responses are meant to protect us in immediate danger, but they are not helpful when the situation requires patience and thoughtful judgment. Calm awareness, on the other hand, supports clearer thinking. It allows the brain to sort information, weigh relevance, and make decisions that fit real life rather than imagined scenarios. In practical terms, awareness means knowing what is true without assuming the worst. It means understanding that health systems monitor rare conditions carefully and that most daily care continues safely and quietly. It means recognizing that preparation exists even when it is not visible. Alarm assumes something bad is imminent. Awareness understands that readiness is ongoing. I often speak with families who feel responsible for staying constantly alert, as if vigilance alone could prevent illness. This is an exhausting way to live, and it does not improve outcomes. The body of an older adult responds best to consistency. Regular meals, familiar faces, predictable days. When caregivers remain calm, seniors sense that stability. Emotional safety becomes part of care. Better decisions are made when science and calm work together. Evidence guides us on what to watch for and what does not require action. Calm allows us to apply that evidence wisely. It keeps conversations with healthcare providers focused and respectful. It prevents small uncertainties from growing into persistent worry. From a dementia care perspective, this balance is especially important. Individuals with memory changes often respond more to emotional cues than to information itself. A calm tone can soothe confusion. Alarm can amplify it. Awareness without alarm protects dignity by honoring how the brain processes stress and reassurance. I encourage families to notice how information makes them feel. If a source consistently raises anxiety without offering clarity, it may not be serving you well. Choose understanding that leaves you steadier than before. That steadiness is not denial. It is wisdom. Awareness asks us to stay present and informed. Alarm asks us to rush and brace. When we choose awareness, we create space for better decisions, kinder care, and a daily life that feels safe rather than strained. This choice supports not only physical health, but the quiet confidence that allows seniors to live with dignity and peace. How understanding changes family confidence. When families begin to understand health information in a way that feels clear and balanced, something subtle but powerful shifts. The constant hum of uncertainty softens. Questions become more focused. Decisions feel less rushed. This change does not happen because every answer is suddenly known, but because the unknown no longer feels threatening. I have watched this transformation many times in my practice. Families who once arrived anxious and overwhelmed gradually become steadier. They ask thoughtful questions instead of searching for reassurance in every detail. They trust their observations and communicate more clearly with care teams. This confidence grows not from control, but from understanding where responsibility truly lies. Understanding changes how families experience care. They stop feeling as though they must anticipate every possibility. Instead, they learn to recognize what deserves attention and what can be allowed to pass. This discernment protects emotional energy, which is especially important when caring for an older adult. Fatigue and worry can quietly erode patience. Clarity restores it. For seniors, this shift is deeply felt. When family members are calm, the environment feels safer. Routines continue with less disruption. Conversations feel lighter. The body often responds with better sleep and more stable mood. In individuals living with dementia, confidence in caregivers can reduce agitation and support a sense of belonging. Emotional safety becomes part of treatment. Science supports this observation. Stress affects cognition, immunity, and healing. When understanding replaces vague worry, stress levels drop. The nervous system settles. This creates space for better physical responses and more thoughtful decision-making. Confidence is not about ignoring risk. It is about placing risk in proper context. From a caregiving perspective, understanding also brings self-trust. Families begin to believe in their ability to care well without constant validation. They accept that uncertainty is part of life, but not something that must dominate every moment. This acceptance brings relief. When understanding takes root, fear loosens its grip. Families move forward with steadiness rather than tension. They feel supported rather than alone. This is the quiet strength that allows care to be patient, dignified, and kind. It is the confidence that grows when information is shared with respect and when learning is allowed to feel calm. Thank you for staying with me until the end of this conversation. Your time, your attention, and your willingness to listen with an open heart truly matter. It tells me that you care deeply about your own well-being or about someone you love, and that care is never small. As we close, I want to gently return to the phrase that brought us here. When we say families are not being told everything, it does not mean danger is being hidden. It does not mean there is something frightening waiting just out of view. Most often, it simply means that information has been shared without enough context, without enough calm, and without enough care for how it feels to receive it. Understanding changes that experience. When families and seniors understand health information in a balanced way, fear begins to loosen its grip. Worry is replaced by perspective. You are able to breathe more easily and think more clearly. You no longer feel pushed to react. You feel invited to understand. Over many years of caring for older adults, I have learned one enduring truth. The body responds best when it feels safe, respected, and unhurried. Healing is supported not only by medicine, but by patience, routine, and trust. When we remove unnecessary pressure, the body often shows us its quiet strength. I hope this conversation has offered you reassurance rather than concern, steadiness rather than urgency. You do not need to hold on to every piece of information. You only need what helps you feel grounded and confident. If health information ever feels too loud or overwhelming, remember that you have a place to return. Senior Health Daily is here to be a calm presence, a steady voice, and a gentle companion on your journey. I hope you will continue walking with us whenever you need clarity, comfort, and care.